Welcome, everybody. Thank you for joining our very first webinar for the Women and SCID Health Talk series. We are very excited to be able to launch this program, especially this month, which is September, and it's Spinal Cord Injury Awareness Month. My name is Rebecca Torres, and I am the founder and director of Backbones. And before we get started, I just want to give some housekeeping details for everyone. If you haven't noticed, the chat is enabled. So if you're wherever you're joining us from, if you feel like saying hello in the chat and tell us where you're joining us from, feel free to do that. There will be a Q&A portion at the end of the webinar. So you may enter questions into the Q&A up at the bottom of your screen throughout the presentation. And there's even a part where you can upvote if you want. If there's like a really good question you want answered, you can hit the button and it'll upvote it. If this feature is not accessible to you, you can wait until the Q&A portion and hit the raise hand button, and I can unmute you and let you ask your question verbally. We also have a transcript available for you to follow along if you'd like that as well. And this will be recorded and on YouTube. We'll be uploading it to YouTube following this presentation, and we will also be sending it to everyone who's registered. If you are new to Backbones, our organization is committed to helping people with spinal cord injuries and similar disabilities find connection and community. And we do this by hosting events both in person and virtual, by facilitating one-on-one peer support and providing resources to individuals with spinal cord injuries and their families when they're trying to navigate life post-injury. I encourage you to check out our website if you haven't done so. It's www.backbonesonline.com to find out more information about our programs. And particularly in the events section, you can find more upcoming webinars under this series, the Women and SCID Health Talk series. Our aim with this program is to offer webinars, offer intimate group discussions and social hours for women with SCI to be able to connect with one another and to learn from one another. And our topics for discussion were decided upon after having 2 listening sessions that consisted of women with spinal cord injuries and disabilities sharing what they wanted to talk about and what they wanted to address. So this program is community-led, and we are going to continue to listen to the needs of our community so that we can offer the programming necessary. I'd like to introduce Emily Lacey, who is our Women's Health Program Coordinator, and she is a doctoral student who's studying disability studies at the University of Illinois at Chicago. She is also a 2021-22 Albert Schweitzer Fellow, and this program would not be happening without her. She reached out to Backbones and said, we need to do this, our community needs this, and here we are today. She's made this happen. So thank you, Emily, and I am going to let you introduce our speakers.
Thank you for that lovely intro. Hi, everybody. So to start off, I'm going to introduce our 2 amazing speakers tonight. The first one I'd like to welcome is Monique Stantz. Monique became paralyzed in a car accident at the age of 16 years old. She then went on to graduate with a bachelor's degree in social work. She is a proud mom of 2, and she has worked for an independent living center where she connected with other women with disabilities. She has started a sister chapter of Women Embracing Abilities Now in Charlotte, North Carolina. The group advocates for equal access to breast cancer and OBGYN medical care, and educates the community about the high rates of health disparities for people with disabilities. Monique is also the outreach coordinator for Raw Beauty Project Health Initiative and has joined forces with the North Carolina Spinal Cord Injury Association to host an annual conference to empower women and girls with disabilities. Welcome, Monique. And then our second guest tonight is Dr. Susan Solman. She is a clinical pharmacist, physician, and an associate professor of pharmacology at Herbert Wertham College of Medicine. Dr. Solman is passionate about disability awareness and addressing the significant disparities and barriers to healthcare that exist for people with physical disabilities. She has incorporated disability education into the physician assistant and medical school curriculum to create better disability competent practitioners and a healthcare system that is accessible for everyone. Welcome, Dr. Solman. Now we're going to hand this webinar over into the two of your expert hands.
Thank you. Thank you so much, Emily and Rebecca, for making this possible. And of course, it's always a pleasure to work with Monique. So this evening, we're going to talk about healthcare disparities that exist for people, especially women with disabilities. And why this is really important to me is because at the age of 39, I went to see my doctor. I got on his exam table. I got a full physical exam. I was weighed, got sent for an MRI, which is a diagnostic test. And I was diagnosed with a spinal cord tumor, ended up in a wheelchair. And almost 20 years later, that was the last time I ever received a full physical exam or was weighed in a doctor's office. And I want to talk about, and I know Monique and I want to talk about why this happens and the importance of us as women knowing that these type of things could happen so we can advocate for ourselves to make sure we get better and equal and accessible healthcare. So I want to talk a little bit about this. And so I'm going to talk about disability. I'm going to talk about the ADA. I'm going to talk about barriers to healthcare, how we make healthcare accessible. And then Monique is going to wrap it up because she's really great in providing tools and educating people on how to be their own advocates. So many of you may know this, but I always like to talk about disability. 1 in 4 Americans, a little bit more than that, are considered to have a disability. And when we talk about disability, we often talk about it just in a singular term, but we know it's a broad group of many types of various disabilities. And people with physical disability is the largest number. Over 13% of people have physical disabilities. So it's also important to know what the American with Disabilities Act is. And I think we all know, but I just want to put it in the context of healthcare. It's a civil rights law, and that prohibits discrimination against individuals with disabilities in all places that are public and all private places that are open to the public. So that means if I am going to stay in a hotel, I can ask for a handicap accessible hotel room. And I'm sure we all know this. We can go to school, we can access public transportation, go to work. We all can, if we're going to a stadium or a concert, ask for a handicap accessible seat. Parks are made accessible whenever possible. So I want to ask you all, and feel free to put it in the chat, what industry do you think is the least accessible, where the ADA laws are least enforceable? And I'm watching the chat. Anybody have any ideas? So I'm going to tell you, here's a hint. It's not Disney World, but it is healthcare. Gretchen, I see, and Julie, it's healthcare. You're on target. Now, the National Council on Disability says because of several reasons, people with disabilities experience significant healthcare disparities and barriers to healthcare as compared to people who don't have a disability. So barriers to accessing healthcare and healthcare disparities, meaning we don't get the same healthcare as other people. We get below the standard often, and we get suboptimal healthcare. And I'm going to explain why this happens. It's because of lack of accessible examination and diagnostic equipment. And it's because of lack of disability training in medical schools and nurse practitioner education and physician assistant programs. So it's a lack of education and a lack of accessible equipment. So I like to bring in, when I teach medical students and physician assistants, I bring in often panelists like Monique to speak to them. Now, because of these disparities, because of this lack of accessible equipment, people with disabilities and spinal cord injuries often get misdiagnosed, get delayed care, and have more complications. And so, as I said, I bring in people to talk to students. And so I want to tell you what Lewis shares with students. And this can happen to women as well. He was in and out of the hospital for over a year and a half, diagnosed with a urinary tract infection. And what he had was an abscess in his groin. So an abscess is kind of like a little pimple which is a little infection. And if it's left to fester, that's a little abscess, it can grow bigger and bigger and bigger and bigger. It could be even deadly if left and not diagnosed and not caught. Abscesses can be very severe. So Lewis ended up with a severe infection so bad, he ended up in and out of the hospital. He ended up with fevers. I'm going to go back to this. I'm sorry, my slides are a little bit out of order. So now, one of the problems Lewis had was he had an abscess in his groin, but he was never examined, so it was never caught. So this is how Lewis gets examined in a doctor's office. This is how I get examined. I know Monique, we talked about this. This is how you get examined. But if you look over to the right, this is how people who are able-bodied get examined. And why I'm telling all of you this is because when the only way you can get a proper examination is if you lay down flat. So I have friends who say, okay, well, I've never had any problems. Okay, I don't get examined. It's no big deal. Well, that means that you've been lucky. So why you need to lay down on a flat surface is because your doctor or practitioner is feeling for the organs in your abdomen to make sure there's no swelling, to make sure there's no masses, listening to circulation, making sure everything's fine. If you're sitting down and get tapped on the belly, it's not an exam. If it was, nobody would lay down on a table. Everybody would get the same exam in a seat. So he didn't get examined on an examination table, get a full exam, and he ended up with problems. Nikki often talks to students as well. Nikki went to see her gynecologist, and she had to bring her own Hoyer lift from her home, which is a patient lift, took it apart. It's a big machine, took it apart, brought it to her doctor's office, put it together so she can be lifted on the exam table because she has a floppy body. She has spinal muscular atrophy, and nobody would lift her on the exam table. And I'm going to explain to you, and Monique will also tell you where you can find resources, that this is against ADA guidelines. So I just want to show you this. According to the Department of Justice and Health and Human Services, it's not okay to examine a patient in a wheelchair. So it's not that I'm just telling you this. This is ADA guidelines. It doesn't provide equal medical care. And according to the Department of Justice, Health and Human Services, and we'll show you where to access this information, ways to provide medical services in an accessible manner is your practitioner should provide a height adjustable exam table, transfer assistance, or Hoyer lift. So there's 3 ways to get accessible care. So there's height adjustable exam tables that lower to the level of a wheelchair so it's easier to transfer. There are Hoyer lifts. That's a way to get care in an accessible manner so you can be lifted on the exam table. And this is what a Hoyer lift looks like, another picture where you can be lifted off of your chair. The sling goes under your body, and then you can be lifted on an exam table. And by the way, if you can get lifted on an exam table, you can get lifted on a CT scan or an MRI. So why that's important is because I know many people report that when they call up a hospital or an ambulatory center and say, okay, I need to get an MRI or a CT scan, even a bone density test. And if you say I'm in a wheelchair, often they will say, well, you need to bring somebody with you so they can lift you on the exam table, or they can lift you on the MRI, or they can lift you on the bone density test machine or the CT scan. Now, while that is consistently told often to us throughout the country, it is completely against ADA guidelines. These hospital systems should have a Hoyer lift or should have trained staff to lift you. They should provide transfer assistance. And we know what transfer assistance looks like, right? Somebody lifts your shoulders and your legs. And by the way, anybody know what industry routinely transfers somebody? Routinely lifts people, where everybody in the industry knows how to lift people. Any guesses? The airlines, right? That's how we get on airplanes. We're lifted onto an aisle chair, and then that aisle chair goes down the aisle. We're lifted back into our passenger seat. So there's, all right, and we all know, nothing's perfect in the airline industry, but this is what happens, is supposed to happen. They know it's supposed to happen. There are structures in place to accommodate people with paralysis, but yet there lacks systems or structures in place to accommodate people with paralysis getting a physical exam. I also want to share that when I got a physical last, when I was able to get on or step onto an exam table, I also was weighed. Weight is important medical information. Weight is essential. And according to the US Department of Justice and Health and Human Services, which are large governmental agencies, they say people with paralysis should be weighed like everybody else, and medical providers should have an accessible scale. Now, I know it's COVID. Not everybody wants to know their weight these days, because certainly I've gained weight, but weight is really important information. So I started with my co-founder, Wendy Crawford, the Raw Beauty Project, and we have Raw Beauty Project Health, and Monique Stamps also works with us. And here we collect stories about women who share their stories and challenges they have had in accessing healthcare. Now, we have one woman who shared that she had a blood clot, which is very serious, and she ended up hospitalized and needed life-saving medication. Now, I know the medication she got, the dose is based on her weight, but she hadn't been weighed in 10 years. She guessed her weight. She had an inappropriate dose. She also ended up having to need surgery. The medication didn't work. Now, we don't know exactly what happened, but we do know she didn't have an accurate weight, and that affected the dose of her medication. Weight is essential medical information. Can you go over how they are supposed to use that scale? They asked me to transfer on and off to measure my chair first. Yes, Gretchen, if you hold on to that question, we'll answer that as well. And there's other options as well toward the end, okay? So where does this all leave us? Well, a third of women with physical disabilities report being denied services at doctors' offices solely because of their disability. Unable to get a proper exam, unable to get weighed, unable to get mammograms even. We hear stories about women who the mammogram machine doesn't lower down to a seated position, so they can't access it. They have to call numerous places to find a mammogram. More than 90% of facilities lack accessible equipment. women experience more delays in accessing healthcare. I know that I just talked about Nikki, who had a problem getting a gynecological exam. Nobody would lift her. She had to bring her own Hoyer lift. And that's because she had someone who can take it apart and bring it. That person wasn't around anymore. She can get a gynecological exam. Women are less likely to get mammograms and routine pap smears. And so there's a lot of challenges we experience. And I want to also let you all know, medical providers cannot deny service to a patient whom they would otherwise serve because he or she has a disability. So when I went to a gynecologist recently and I asked them if they can help me onto the table, and they said, no, nobody in the office could touch me, then I wasn't able to get the exam that I should have gotten because of my disability. So they needed to provide an accessible table. They needed to either have an accessible table, a Hoyer lift, or people to help me transfer onto the exam table. Now, a lot of people would have left the office, but I know the laws and I can advocate for myself. And I said, please bring in the doctor. You can't deny me care. This is something you need to help me on the exam table. And so I did eventually get the exam that I needed. And so women with disabilities can do amazing things, right? We can play ice hockey and go sailing, and then we can go surfing, and we could play golf and snow skiing. And, you know, I live in Miami, we go to the beach and play tennis. But when it comes to healthcare, we get accessible parking, we get accessible bathrooms, but we don't get accessible examination tables and accessible diagnostic equipment. And so I think it's really important for us to know that these stops should not occur. And so we need to advocate for ourselves. And Gretchen asked, how do you, are you supposed to weigh yourself in one of those scales? So usually what happens if you roll onto a scale, and Gretchen, I think you're talking about the scale that I showed a picture of, where you roll on, you do have to get off or have somebody either transfer you onto a table or a chair, so you know the weight of your wheelchair, and then you have to get back on. So if you weigh yourself with the wheelchair, you have a total weight, then you have to go off onto something else and just weigh your chair. And then once you know the weight of your chair, then you hang on to that weight, and then you can measure your weight moving forward. That's one way. Another way is there are accessible examination tables that have scales in them. So tables that lower down to the level of a wheelchair. And once you get on it, you can get weighed. I see oftentimes, or the only time I ever get weighed is when I'm admitted to the hospital. So here Misty said, oftentimes the only time you're weighed is when you're admitted to the hospital and there's a bed that has a scale in it. So yes, there are hospital beds that have scales in it. And so you can get weighed if you're admitted, hopefully not, into a hospital. But everybody else, every time they see their doctor or primary care doctor, they get weighed. So we should get weighed just as often. And so I want to bring on Monique, and you can share some of your experiences and tips and tricks that we all should know on how to advocate for ourselves. And you're on mute, Monique. You're still
Hi,
on.
everybody. Can y'all hear me now?
Yes.
Okay, awesome. So I, like Rebecca shared, I was injured when I was 16 years old, and I came to the realization that there was something really wrong with our healthcare system when it came to people with disabilities, in particular women. was when I was pregnant with my first child. And that pregnancy, it went okay. However, my first exam in getting my ultrasound was all done from my chair because they did not know what to do. And, and me not knowing my rights at that time, I allowed them to do we did the whole vaginal exam, all of that from my wheelchair. And it really, it was very much a humiliating experience, having to be pulled down in my chair and all of that. And so I honestly, I had to bring several people with me, about 2 to 3 people with me. The bigger I got in my pregnancy, to help me get onto the table after that first exam went so horribly crazy with the first exam. And so, but overall, my pregnancy went pretty smoothly. And then, and I did not get weighed. I never got weighed with my first pregnancy.
Monique,
when I had my daughter.
And I just want to add why weight is important. So weight is monitoring your health and the health of your baby. And
Right.
that's why everybody gets weighed when they're pregnant. So, and you didn't. And
Not in the first one. Mhm.
Okay, right.
And so I, with the second pregnancy, first of all, I want to touch on a little bit about attitudinal barriers. The first pregnancy was very much physical barriers. Second pregnancy was, I got met with, how do you take care of the one you have at home? Oh my gosh, 2 kids is too much for you. Who helps you? I was very interrogated. I was terrified that DSS was going to be at my door every single day. Guys, it was horrible. But as far as the physical barriers, again, the exam tables were not accessible. I had to be lifted on. And then when I went to the first doctor, who was very horrible to me, who basically was low-key advocating for me to abort my son, I did not go back to him, and I found another OBGYN, and she was very honest, which I appreciated, and said, I do not feel comfortable providing your prenatal care. So she referred me to a high-risk clinic, which was great. However, the high-risk clinic of all places did not have a height adjustable exam table. So, and that again, I did not get weighed at the high-risk clinic. I got weighed when I would have to go in the hospital with, Braxton Hicks and things like that. So that was the only time I actually got weighed with my second pregnancy. So long story short, that was basically my introduction into, okay, this is not right. Something's not right here. And started doing some research and learned of the Access Board and their regulations on medical diagnostic equipment, and started doing some advocacy after I had the kids, after I had my son, and I worked with that high-risk clinic to bring about some change, which I'm very, very proud of.
I also, and I hope you don't mind, Monique, if I jump in. Monique mentioned attitudinal barriers. So this is a known problem with healthcare practitioners. They have a barrier. So we have physical barriers, and so which stop us from getting equal and accessible healthcare. And then we're stopped because of a provider's attitude. So Monique is sharing, because of an attitude, a provider was saying, "You sure you want to have a baby?" Or maybe you won't be a good mother. Or we get a lot of people who say, well, you're fine. You don't need that exam. Or we have, I know Wendy Crawford is the co-founder of the Raw Beauty Project Health. So she often shares a story how when you go, especially in Miami and it's hot, or in Florida, people are prone to skin cancers. So everybody should get a skin check, meaning you should go to a dermatologist, or not everybody, but if you do go to a dermatologist, they check every area of your body to look for any sign of skin cancer. So she shares how she went to the dermatologist with her husband, and every crack of his body was checked for skin cancer because it can grow inside your ears, every crack. For Wendy, she shares that they just said, no, we can examine you in your chair and we'll just look at your back and your chest and your legs. So they weren't examining her entire body, but her husband, they were. So that's a attitudinal barrier. They're just not thinking, they don't think that we should get the same healthcare for some reason. And it really stems from education. And that's why I'm at my medical school, I spend a lot of time with students educating them on how to care for people with disabilities. And we bring in real patients, thanks to a grant from the Craig H. Nielsen Foundation, real patients with disabilities, so they can train our students and educate our students on the issues that people with spinal cord injuries have. And so they know that they have to be examined like everybody else. So Monique, I'm sorry, I probably threw you off. Do you have any more?
Oh, no. I'm glad that you brought that up. And so it was after that point, that I learned to advocate for myself and did some research, starting with the U.S. Access Board. And that was in 2010, I believe, when they first introduced the regulations on medical diagnostic equipment.
And I'm
but
going to show
it hasn't really been enforced. That's the issue right now.
Yeah, Monique, the guidelines that you're talking about, if they're here, and we can put that link in the chat. And then we also have Raw Beauty Project Health, a website. And if you go to resources and you click over here, it will give you all the guidelines that Monique is talking about. So there are guidelines that say we should have accessible care. We should get the same care as everybody else. We should be weighed. But like Monique just said, these are things that are not enforced. So there's several reasons why. It's an industry where it's hard to enforce the law right now. And many of us don't know what our rights are. We don't realize the healthcare we should get. So I recommend that everybody print this out when they go to their doctor. And then you can also subscribe on our website so you can get updated information on healthcare. So Monique, I know I threw you off.
And we have oh no, you're fine. We have also on the website, if I'm trying to see, Susan, are you able to click on it? But I believe it's under the resources tab as well. We have like a Q&A. So to help you be informed, I would suggest that you print that out as well. That is a very, very, very helpful tool to have, so that you'll know what questions to ask when you go to the doctor and what their response should be.
Yes, and what I can do is kind of walk people through it right now. On our website, if you Raw Beauty Project Health, be informed, answers to commonly asked questions. Is it okay to examine a patient who uses a wheelchair in the wheelchair because they can't get on the exam table? The answer is no, or generally no. Is it okay to, all these questions? And then down here, you can click on here, and that will take you to the documents that we're talking about, that Monique is talking about, that Department of Justice and Health and Human Services has provided. So it's important for us to be informed. It's important for us to be knowledgeable. Monique, I don't know, do we want to take any questions? Does anybody have any questions or experiences? I see Cheryl Price. I was weighed during pregnancy by my then husband. And Cheryl, your husband picked you up, stood on the scale so you can get weighed. Otherwise, you wouldn't have gotten weighed. And if your husband, I would imagine, wasn't in good shape, you wouldn't have gotten weighed. So these are things that should not happen. I see Jennifer said that you didn't get weighed only in the emergency room. I think Gretchen said, I think disability education should be required classes in medical schools and other postgraduate healthcare education. Yes, they should be. And they are. In my school, we were able to get height adjustable examination tables and a Hoyer lift, thanks to a grant from the Christopher and Dana Reeve Foundation. And then thanks to a grant from the Craig H. Nielsen Foundation, now we're bringing in patients with real disabilities so they can be examined on this equipment, and we can continue to educate more healthcare providers so they know how to care for people with disabilities, how to provide equal and accessible care. Any other comments, questions?
We have a couple of questions that came in with the registration, so I'm going to read a few of them off. We can kind of start a conversation from there. So someone had asked if there was a type of doctor who specifically treats people who have spinal cord injuries. What is the title of the doctorate that they should seek out?
Yeah, well, first, let me tell you, I'm a podiatric physician, which is a foot doctor. So just to be clear, but based on my experience, it's a physiatrist, which is a doctor who specializes in rehabilitation medicine. And they know more about spinal cord injuries than generally other specialists. However, we still need general health care. You know, they don't specialize, they don't monitor blood pressure, or they do, but you know, if you go to your regular doctor, they'll monitor you for diabetes and you check your cholesterol and check your blood pressure and your bone density and all these things. So often people will either see a physiatrist and a primary healthcare practitioner.
Thank you for answering that question. And another question that was asked was, what are the issues that women of color with SCI experience accessing healthcare? I'm not an expert in that, so I don't have an answer. I don't know if either of you are.
I can speak to it from just from my experience with my pregnancy and the way that I was judged about. I'm sure women of all colors experience that, but I do believe because women of color don't get the same treatment as far as attitudes and direct care when it comes to prenatal care. And so just imagine being a Black woman and a Black woman with a disability and the way I was treated. And one thing I forgot to mention, after I had my daughter, I did have a post-eclampsia stroke. That can happen to anyone, regardless of their if they have a disability or not. But part of that was because they wouldn't help me transfer. They were rushing me after I had her. We need your bed. We need to get you to another, I guess, to a regular room. I was still in the birthing room, and I almost fell trying. You know, I was weak and just tired, and you know, and I did it, but that upset me so bad, and it was just heavily on my mind. After I had her, I was just completely stressed out. But it's, yeah, that's a whole issue within itself. That
So Monique, in terms of often people of color are marginalized, women of color
Yes.
are further marginalized, and then women of color with a disability even further marginalized.
right. The death
And these-
rates amongst women of color who have babies is astronomical. So just wanted to
Really?
point that out. Mhm.
Wow. Wow. I see somebody, Tara wrote, even something as simple as getting x-rays have been challenging. Yes. Yes, absolutely. I broke my toe. Had to get an x-ray. I try to go to medical practitioners that I know. I'm a foot doctor. So I went to my friend, who, it was incredibly challenging trying to get an x-ray. Incredibly challenging trying to get a pap smear. And it's so challenging, it makes you not want to go and get the exams and the tests that we should get, because healthcare should be about getting preventative care. Getting care so you prevent problems, getting the checkups, getting these types of exams to prevent problems. I also want to show something else. On our website, Raw Beauty Project Health, if you go to the page exhibit, you'll see we're doing an art exhibit, and it's going to be portrayals of women with disabilities advocating for equality in healthcare. And then working on this with Wendy Crawford, Monique Stamps, and Cheryl Price, we are doing this really creative art exhibit, and Wendy can tell you more about that part. But if you sign up on our website or subscribe, we can, you'll find out more. And the reason why something like this and everything we're doing right now is really important is because we want to educate women and the public about the healthcare disparities that we experience, the lack of accessible healthcare, so we can create change. We want to change things, and it has to start with education. And so, I know that I'm educating medical practitioners where I work, and we want to educate people and women with spinal cord injuries to bring about change.
Right. And Gretchen posted, women of color are often not believed of their symptoms, similar to people with disabilities not taken exactly. And so I did post a link about, in specifically addressing the pregnancy and our, being less likely to survive, because not a lot of people know that. So.
Wow. And then you combine it with somebody in a wheelchair who's not getting weight like everybody else and is not, has these attitudinal barriers. Any other questions or comments?
This is Rebecca. My video's not up, but you'll hear my voice. I have a question. In my experience, I was injured very young. I was a teenager, and I was a patient at Shriners Hospital, where they had a whole care team of people, from your doctor to PT to OT to urology to everything. Once I moved away from Shriners and had to find adult health care, you still need all these doctors. And there is a big challenge in communicating between all of these doctors, and being able to advocate for yourself, in particular with doctors that are not experienced with spinal cord injury. Often I feel like people assume that some of my symptoms or things are related to my spinal cord injury when they may not be. And so do you have thoughts or tips on how to navigate that and being able to get all your doctors on the same page sometimes?
Well, first, let me say what you mentioned is referred to as diagnostic overshadowing. When you said often you'll have symptoms and they think it's your spinal cord injury when it's something else. So for example, there's an instance where a gentleman I knew was gaining weight. He had bad gas, which certainly that can happen to anybody in a wheelchair, but his symptoms were getting worse and worse. And all his doctors attributed it to his paralysis. So when doctors just say, oh, it's because you're in a wheelchair, attribute everything to your disability, that's referred to as diagnostic overshadowing, where if you didn't have a disability, they would maybe sort of take you more seriously or say, well, let me check you out. So this particular gentleman, he was gaining weight and his abdomen was distended. He never even got a physical exam. He ended up having a tumor in his abdomen. So there's no simple answer to that other than, listen, you've got, like telling your doctors, listen, I need you to hear me. I know my body better than anybody else. We know our bodies better than anybody else, and something's wrong. This is not typical. This is not what I experienced because of my disability. I need you to hear me. I need you to work with me. I need you to communicate with my other doctors. So we have to be the ones to drive our practitioners and tell them what we need. Anybody have any other comments or thoughts?
There was a really good comment and question that just came through on the chat. So Tara said, when I have problems with accessibility in medical and dental appointments, I find myself often apologizing profusely and making it look like my fault. Does anyone else feel like that? And how do you develop an advocate mentality?
I'm gonna take the first comment. I'm gonna have Monique talk about how you develop an advocate mentality, because she's great at that. But with the Raw Beauty Project and the exhibit that we're putting on with women with disabilities, we hear that all the time. So we had a woman who shared that she went to get a pap smear and her doctor said, well, how about if we do it on the floor of the exam room, because she couldn't get on the table. And she thought, well, first of all, there could be nothing even more degrading than getting on the floor to get a pap smear. And then she found herself apologizing. So I think that's a common thread. We talk to a lot of women who feel like it's their fault and they're apologizing, but it's not. So I think there are a lot of people who feel that way. And that's why it's important for us to come together. It's important to have these type of conversations. And again, thank you, Emily and Rebecca, for bringing us together and connecting so we can learn, no, this is not our fault. This is a system that's not accessible, but we're living in a country where everything is supposed to be accessible, but healthcare is not as accessible. So Monique, how did you develop this mentality?
I honestly, when I started working for the Center for Independent Living, because I'm from a rural area. I didn't know any other women with disabilities. I didn't know very many people in general with disabilities before my injury. And so it took me finding our local SEALs and them teaching me individual advocacy and systemic advocacy. Started with me learning the Americans with Disabilities Act first. And working with those they call peer mentors or independent living specialists that can help you learn how to use your voice. Because I understand it can be very intimidating. It really can, but your voice matters. It's just, just finding it. And I would say definitely, connect with like I said, groups like this. Groups like Women Embracing Abilities Now. We, have, weekly calls amongst each other and talk about situations and share ways that we can advocate for ourselves. Get a support system and, and those resources. I think that is very important. But I honestly, I would start with, contacting your local Center for Independent Living.
And the resources, we make them very accessible on the Raw Beauty Project Health website. And I've written this down because Monique has shared with me, know the laws, use your voice, know these resources. And there's really a power with connecting with other women. So we know we're not alone. This is something we should not apologize for. And I know several people put in the chat. We hear this from women all the time, and it's something I do also. I'm sorry, I'm gonna need extra time. And healthcare is a system now that there's time pressures. And so I know I'm gonna need extra time getting on and off an exam table. But that's what we need. That's who we are. And we're entitled to the same healthcare as everybody else. So it's something we need to know. I'm also going to put up this slide. If you have any questions or comments, here's Monique and my email. And then of course, Rebecca and Emily, you can contact them. So any other questions or comments?
That's right, Rebecca. Be unapologetic women.
Yeah, that's right. Yes. And I think it's really empowering. For me, when I ended up 39 and paralyzed, it wasn't till I connected with other women that I started feeling empowered. I didn't feel alone. I started to find out, who were the good doctors to go to by connecting with others. I found women to be the best resource.
Mm-hmm.
We
and
have
it was very hard for me to initially to go back to that high risk clinic and say, okay, now that I've had my baby, I need to talk to you. Knock, knock, knock. And with me working for the Center for Independent Living, I did have a backing, because of my job. So that's why I say, take advantage. Don't be intimidated. Contact your SEAL so you can have someone with you. And eventually, once you learn how to use your voice and know the laws and know the resources, you'll be able to go into any space and say, knock, 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 let me talk to you.
Yeah, and unfortunately, that's what we have to do until we start to make a difference. And I think, Tara, I'm not sure quite what you're asking. I don't know if I'm reading that correctly, or if you can unmute yourself and ask. They expect a person to apply for financial aid. I'm not sure. Maybe I'm going about getting help the wrong way. I don't think I'm reading your question correctly, but if you want to retype it or ask. About financial assistance, I'm not sure what you're asking. Hi, Tara.
Hi, can you hear me?
I can, yeah, thanks.
Oh, hi, thank you. What I recently had happen was I was working with someone in the state of Illinois independent living, and I was looking for assistance with just basically cleaning my house, okay? And they wanted me to apply for Medicaid. And I said, I have a full-time job, 2 degrees, and I'm not going to qualify. And I don't really want my employer to know that I'm trying to get on Medicaid. And they said, well, you can't do any of this unless you apply for that. And I just thought that this was insane. And I didn't know if maybe I was the one that was being stubborn or, and so long story short, I have no assistance, and I basically am in a wheelchair and learned to vacuum myself. But it's just like one barrier after another. And I didn't know if I was the one that was being crummy about this.
Well, I know, like, that's like in terms of like healthcare advocacy, and that, I know that's like having access to like medical that's a completely different topic. So that's something that I can talk to you about separately, and each state is different. So yeah, that's a little bit different than what we're talking about, but I don't mind chatting with you. If I
I'll
think
put
my
it here.
email is in there.
Yeah,
Yeah,
I'll put
about
your
that.
email.
Yeah. Yeah, just shoot me an email and we can talk about that different, that's, different
Kind of a different type
area.
of
Yeah.
topic. And certainly not my area of expertise, and I think Monique could provide more guidance for you on that.
Yeah, because it's like, each state is very different as far as the PCA resources versus what they do as individual and systemic advocacy, if that makes sense.
I know this is an hour, I believe, our Zoom meeting, so I don't know if there's any final questions or comments or.
Yeah, if there are any, otherwise Rebecca and I will wrap us up. Oh, looks like we have one more question. I just got a little notification that somebody has a question. Question hasn't appeared yet.
That was me. I was just saying if we had one more
Oh,
question
we
before
have
we
one.
wrapped up.
Sorry.
Yeah.
All right. It looks like.
Oh, wait, and let me just read. I think we have one more come in. Daryl, this has been enlightening. Thank you for sharing your experiences. Thank you for coming. And then there was Misty. One of my doctor's offices has a Hoyer lift, but it's not a practical one. It would almost require a person to be able to stand to put the sling under them. So I've had to end up going to the hospital for a CT scan or other diagnostic issues. How can I make them get something that is more practical? Who would I talk to? Where can I start? Well, one thing is, there's, in terms of using the sling, if it's done correctly, a sling, you shouldn't have to stand. It should be slipped under the person, and there's a way to slip it under you without having to stand. So it's a lack probably of training on them. And then what also happens is that if you have to go to a hospital for a CT scan, so let me tell you where I made that mistake once. So I was seeing my doctor who said, we want to do an echocardiogram, check with the 3D, your heart, and it's usually done in a doctor's office. And she said, but you know what? I can't get you on the table. It's not accessible. I'm going to send you to the hospital. I thought, okay, sure. So I went to the hospital. So I would have gotten a $25 bill if I had it in her office, but because it was in the hospital, I got a $1,500 bill. So often if you are sent to the hospital, realize that you're going to be charged exponentially more money, and something which is completely against ADA guidelines, because you can't charge somebody more for their disability. And in essence, we're paying more because we're disabled. So keep that in mind. And if they can't use the Hoyer lift, then they should be able to transfer you, have two people lift you, one under your shoulders and one under your legs, onto the CT scan. There's another way of providing assistance. If there's a gurney, which is a bed that lowers, that can lower all the way down, easy to transfer onto that, and then it rises up. So if you go to the resources on Raw Beauty Project Health or any of the other resources, it will show you what those options are in order to get accessible care. And then you can even print it out and show them to your doctor.
And also, Misty, she said, how can, and also besides the Center for Independent Living, each state should have what they call a P&A, Protection and Advocacy, where they actually have attorneys on staff. And they will contact your doctor's office and say, hey, you can give them the options. You can purchase this, or they'll provide like mediation and actually have the staff trained. So there's lots of ways to get them to make things more accessible to you. And also, Gretchen is right. That was the issue with the high-risk clinic that I went to with my second child. The rooms were very, very, very small. Yeah, it's just so much work to do, guys. And I just think at this point, these conversations are super important. And what I hope to see with the Raw Beauty Project Health exhibit and these conversations is that somehow, some way we can, I would like to see all of us hike it up to the Capitol.
That's right, Monique.
That's
And
like,
also, that's
sick of
right.
it.
We're on the way. And then also, if you click here on our resource page, it will take you where you can file a complaint with the Department of Justice.
Right.
So we know they're busy, but the more complaints we file, the more attention we're getting. So it's really important to do that. And again, that's on our website.
All right,
Thank you
we're
very
gonna, oh, sorry, Rebecca, I'm talking
Go
over
ahead.
you. I was gonna say that we're gonna wrap up. We just have a few little closing comments to make. We also want to make sure everyone knows about our upcoming, our next webinars that are coming up. So October is self-esteem and body image, November is sex and disability, and December is addressing and surviving abuse. And then a lot of the questions that we received for the registration was asking about aging or menopause. That is the topic for March. It already is planned. We didn't talk about it today because we feel like there's so much to talk about with aging or menopause.
Yeah, and I know Monique said that somebody wrote even oftentimes rooms are too small and how does a Hoyer lift fit? You're absolutely right. And there are Hoyer lifts that can go on a ceiling, but yeah, these are all issues and the more we're educated, the better.
Thank you for that, Dr. Solomon. So we have these upcoming events. We also have small discussion groups for more intimate conversations about each of these topics. If you go to Backbone's website, you can sign up for the women's programming. It's exclusively for women with SCI. This webinar has been recorded and will be available on our Backbone's website, our Facebook page, and on YouTube. Thank you everybody for coming here tonight, and a big thank you for Monique and Susan.
Have a wonderful evening, everyone. Thank you.
Thank you. Thank you, Gretchen, and everybody else for your comments in the chat box. And I look forward to attending more of these other upcoming events. They look great. And thank you, Emily and Rebecca, for putting these together. It's really important for us women to connect and learn.
Absolutely. This was awesome.
Take care, everyone.
Good night,
Thank you.
everybody.
Bye.
Bye-bye.